Right. To give audio today. You never know. All right. Let me check. All right, y'all. I don't know if you can hear me or not. I'm hoping you can. Um, I don't see the live. I know I see somebody live with us, at least one. I don't see the live stream showing up. So if you can, drop me a note. It says that my voice is registering. I may have accidentally put it to my private page again too, which is kind of a no-no. I don't mean to do that, but it happens sometimes. But I'm not seeing myself live. I know that I'm live. I'm confident that we're live, but I don't see it. Today we're going to be talking about rethinking psychiatry. So this is something that is very, very near and dear to my heart. And it is, because we're going to talk about a lot of things that I think is going to touch at least somebody in our life. There's, statistics that at least 80% of people have suffered or are suffering from. All right, awesome. That is up. Who are suffering from anxiety and or depression. And we are going to discuss how we can maybe be doing better in the profession, meaning in really want to be able to see the live first. And I'm not able to see it. I see someone there. If you can, let me know if you can hear me or not. So we might go ahead and get started. I don't know why I can't pull up the live. Usually I can pull up the live on my Facebook and check myself. But it says that I'm connected. So I don't know for sure, but I think we might just go ahead and go with it and see what happens. Maybe I can even go to, I'll get the slides pulled up here. I would love to know where you are coming in from. What is your background, your reasoning for being here before we really get into this? I know some people are going to be watching for the CME, for the free continued medical education. It will be free if you watch live or if you watch the replay within 24 hours. The reason why I do that is because I have to kind of monitor it to see if you've actually watched, and I'm only going to do that for free for 24 hours. That's kind of like my gift to everybody. I just really want to get this information out to people. Of course, if you are not in the functional world, you're not wanting to be, but you're interested, maybe for your own health even, I have some incredible practitioners who have gone through. We are now established as the Institute for Functional Nurses. And we have some incredible practitioners who go through that. So if you see something along this line, a lot of people actually get started in the functional world for their own health. they get kind of burned out in not being able to find answers through what they need in their life. So they end up reaching out to a functional practitioner. And if that's you, then reach out to me and I will direct you. I know that there were several people before who did that, but they did not put in their email address or their name, so I was not able to reach out to them. If that's you and you're here with us again, reach out to me and I'll connect you. That's part of what I do for my functional practitioners is I connect them to, I help connect patients to people who are the right fit for them. And I always have to start every one of these with the disclaimer that while I am a practitioner and I am a functional practitioner and I am a medical provider, I am not your medical provider or functional practitioner. This information is for educational and information purposes only. But we are going to go ahead and just get started and really hope and pray that that everyone can hear, because I'm so worried about that. My brand new computer doesn't work like it's supposed to, but I've done the workaround of getting the microphone and I'm just trying to see. Okay, let's see if I can hear myself here. And I'm just trying to see. Good. Okay, I heard myself play back. So I think y'all can hear me. Fantastic. Let's get started. This is really fun. And it's something that we're going to touch on a lot of really interesting things. Of course, we don't have enough time to get through everything that you would need to know as a functional practitioner in the mental health realm. You're going to get a really great idea, though, of how just hugely encompassing this is. And we're going to talk about some of the kind of fallbacks to, conventional treatment, some of the pluses to it. I always want to say that we are not, at IFN, we are not the individuals who are anti-conventional medicine. You'll see that a lot where there's like a dichotomy there and people are either for it or against it. They're either for functional, they're against it. I really and truthfully not even just believe. I know that this portion of the functional world is going to be impacting and influencing the conventional world. It already is in a very, very big way very soon. There is just way too many NIH studies out there now that we know that we're going to have to start making some shifts here pretty soon on how we look at mental health. And this is something that it's going to be, this and GI health, I feel is the absolute, it's going to make the biggest waves going forward. We're really, 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 really at the beginning of this wave. And it's an exciting time. It's also a time when we don't know a lot, just like we're going to talk about the microbiota. And, the unfortunate part of it is because this is still kind of new and evolving, and because we don't have a lot of actually really healthy models to look after, sometimes we don't actually know quite where to go in some areas, which is exciting but can be difficult. And that's why you really have to have a system and you really have to test, not guess, is something that we say a lot. And it really a little bit about that, but also just how many different things affect this. There are so many different things. I have notes in front of me that I wanted to add and talk about as well. So we're hopefully going to get to kind of everything. But I think this is going to give you a really great foundation for my main goal of today is just to really kind of broaden everybody's idea of what mental health is. As a provider in the conventional world, most often we have two routes, right? We have the way that we're looking at people from a psychological standpoint, and we're working with cognitive behavioral therapy. We're working with psychology, where we're actually, we're looking at the mental processes. We're looking at the way that somebody thinks about things, restructuring their mind, helping them overcome traumatic stressors, thinking about things in a more positive way that can influence behavior and influence mood in a positive way. And, we're looking at, there's some things that are looking like EMDR therapy, where we're restructuring the feelings around the experiences. It's much more involved than that, but that's the essence of what that does. Eye movement desensitization is, it's calming to us for our eyes to go laterally. That's what EMDR works on. And, that's kind of a therapeutic way. And we take you through those negative emotions, but try to restructure it into a more positive way. The same underlying pinning to what, cognitive therapy does, just in a different way. But there's the physiological and the psychological side of that. And then we just kind of stop there in the conventional world. And we try to boost their serotonin. We try to boost their dopamine. Whenever I was very brand new provider and I first started taking care of patients, it was overwhelming to me how many patients were like, this one doesn't work, this one doesn't work, and I'd have to change them a lot. So then I got really good at learning, okay, does this person need more dopamine? Do they need more serotonin, based upon their symptoms? And based upon their symptoms and the right medication, I would start them on the right medication. I would get more results by doing that. I'm sharing that portion of it because there is a belief system out there where, conventional medicine just doesn't work at all. And I don't believe that. I've practiced it. I've known and I've seen when I've practiced it not as good as maybe I could have. And I've practiced it really well. And I knew and understood the underlying symptomology that the patient had, and the underlying pathophysiology and the pharmacology of the medications, and married that together, and I've seen better results. And that wasn't coincidence, right? That wasn't coincidence. However, there are certain things that we're learning now that maybe conventional medicine is still kind of a fallback. And that's actually, this isn't in the slides, but it's something that I wanted to talk about. And in our introduction email, I always try to make sure that I touch everything that I tell you all we're going to touch on. And this was one. I'm actually just going to do the citation here so you can see it. And it's a good segue either way into what we're going to talk about. I don't have an actual slide on it. This is if you want to click, I think that link will take you to the actual, if you want to read the full published study. But this is talking about how, SRNIs actually are thought to possibly negatively inhibit and affect the gut microbiome. Now, that's really important because we know how important the gut microbiome is for mental health. That's something we're going to touch on quite a bit in today's lecture. And you're going to see how much of a difference, much of a big impact this actually makes to individuals. But they actually found in this that there's several individual differences that actually influence the gut and the SSRIs, and how they also exhibit the antimicrobial properties within the gut axis. And that's a negative effect because sometimes it's harming those gut microbes that actually make our serotonin, that make our dopamine. And without those being present in our gut, because we spoke about this in our last lecture, I've seen 80% in some studies, most say 90 to 95% of our serotonin is actually made in our gut. And if we're knocking that out, then we're really taking away from a big part of our overall health. Now, I say that not to give you a picture perfect idea of this is what's right, this is what's wrong. I'm here to say that we need to be encompassing an integrative perspective on this. The other part of that is some of these interventions, not all of them, depends on the individual. Some of these interventions are not going to be necessarily the right fit for everybody. Some people are not going to be willing or wanting to do these interventions that they would need to do to correct their gut health. That would mean, worrying and not worrying, taking command of their stress, of decreasing that stress, because the effect that it has on hormones, which has a downregulation to the effect on our gut microbiome, our diet and how that changes our gut microbiome, all of those things, sleep. We're gonna see how so many things in our life actually make a big difference on that, and not everybody can or is willing to really make those changes for several different reasons. So to each their own. I am not knocking anything. And the main thing is that we get help, and that we're mentally healthy and happy and the best person we can be so we can serve others. That is what, I think we're all on this earth to do. And that's why, like, even today, I really wanted to get this message out. It's not perfect. I didn't have it perfect. I wanted it to be perfect before we went live. And but we're still just going to go for it because our purpose is message and impact. And I do believe that a lot of what we have today is going to still impact people in a big way. And we always have time to go back and kind of go back through things. Okay, so digressing a little bit, meaning we're going to move on to the next slide. Okay, so root causes in functional world, if you aren't familiar with that yet, we're really looking at the root cause of any disease process or ailment that we're looking at. There are tons of different causes. That's why getting a really comprehensive view of our patient, a comprehensive history of our patient, and really understanding what they've gone through, what might be their biggest triggers, their biggest factors that can influence their overall health. We really need to know a lot of different things, and it's not just which medication might be best for them. And in the functional world, we really try to avoid 95% of the time we try to avoid medications at all and correct the underlying root cause. Of course, there are certain things that are, going to have to be addressed in a different way. They're not the physiological. A lot of what we're going to talk about today is the physiological things that impact mental health. Remember, I said at the very beginning, there's physiological, there's also the psychological. Those both can impact the individual's mental health. And we're not going to talk about, the psychology of treating PTSD, any of those things. But we're going to be focusing more on the physiological root causes of anxiety and depression. Many times, especially because it is so interrelated, one can start and cause a cascade of things. That trigger for, let's use PTSD as an example, can trigger that increased stress, that increased cortisol, that increased breakdown of our hormones. That breakdown of hormones can cause us to have worsened anxiety, worse symptoms. So it can kind of feed upon itself until it's in a place where there's multiple different things that we have to kind of correct in order to see a result with our patients. And the other part of that I want to preference this to is that most of the individuals who I work with are nurses and practitioners. There is, of course, a difference between if you are a functional nurse coach or if you're a functional nurse practitioner. There are two different roles that you're going to have in that legally and how you can address this. The other part of that is, even as a nurse practitioner, you need to be cautious in that. And this is something that many people will not tell you, especially individuals who do not know specifically the nurse practitioners board of nursing and our laws. They will just make it sound like you can treat anybody with advanced PTSD or schizophrenia, all of those things. If you do not have, as a nurse practitioner, even as a nurse practitioner, because there is a postgraduate certification, you have to be consulting with somebody who either has that postgraduate certification or a psychiatrist, an MD, a DO who specializes in that. That referral has to be out if they're advanced past the just general anxiety disorder or depression. And the reason for that is because we now have a subspecialty for that. We now have a certification for it that individuals should go to. That doesn't mean that you can't take over care. That doesn't mean that you can't still work with them at the functional level to try to help them, decrease medications with their provider. Never say, oh, you don't need that. You don't need that medication. Let's just stop that. That's not what we're saying here at IFN. That's not what we ever recommend. I know a lot of functional worlds will say that, and naturopaths will recommend that. We do not here. I'm going to raise this up a little bit because the audio tends to be a little better if I talk straight into the microphone. And I just remembered that. But let's talk about some root causes and underlying factors that are often overlooked in the conventional world. So there's actually a direct correlation between high intake of sugar, alcohol, processed foods, and caffeine that can actually increase our risk for major depressive disorders. So the other thing about this, especially sugars, and I think it's on our next slide, but sugars, fatty acids, and amino acids. So it's a really interesting, actually, I think we do have it on the next slide. So I'm going to wait until we have, yes, we're going to talk about the whole body experience. So we really know this. You can know this from a just basic human level, Because if you've ever eaten something that you think, oh my gosh, it's so good. I remember, I'll never forget whenever I never noticed I did. I guess I'd done this my whole life, but whenever I will eat something sweet or indulgent that I don't usually let myself have, but I do believe in, gotta have moderation, right? Whenever I do let myself indulge, my mom pointed out, of course, your mom always knows you the best of anyone. She says it's always so cute, to her it's cute, that whenever you eat something sweet, your toes curl. And I thought, wow, that really is a whole body experience for me. I just love it so much, but I do not let myself have it. Very often I try to limit it at a regular, try to not have it regularly. But when I do indulge in something sweet, I try to make it healthier sugars, not as processed, no high fructose corn syrup, try to avoid the red dyes, all the things. But it is a whole body experience. So you can really see just from that alone, oh, I think maybe my food can actually affect my mood. I mean, it's a real aha moment, and it's that gut microbe interaction there is a real thing, and we've always felt it. We've always noticed it. We always we see it, but sometimes it takes it hindsight of really really looking at it in that way. So placebo-controlled trials showed effect within 1 week of intervention in studies that looked at eliminating these processed foods, sugar, and alcohol. And certainly many people who have this high in their diet and the caffeine will notice a strict improvement. The caveat on there that I want to, of course, mention that most of us will already know is that alcohol can have a withdrawal. It can have a very, very, very serious withdrawal. That is a medical diagnosis that needs higher attention than you can give, especially in the functional medicine world, but higher even in the primary care world. So that can be something that you need to be cautious of if somebody has an actual physiological addiction to alcohol. Of course, with caffeine withdrawal, sometimes people feel very run down. They have headaches. They feel foggy. They feel, it's hard to get over that. Caffeine can be one of the most addictive things out there. So those can have withdrawal syndromes that you have to be cautious of. Some people, after the caffeine withdrawal, a few days, they'll start to feel a major improvement. But you do have to keep that kind of in check, and also realize that sometimes the withdrawal, even from sugar alone, they'll have a high uh, reaction to that, and they'll feel really run down at first, because that causes the sugar causes that increase in the dopamine. It causes that dopamine hit. So whenever you withdraw it from somebody who's used to having it, they'll have a little bit of a withdrawal for a little bit. The only exception is that there was an inverse relationship with drinking tea daily, specifically green tea in low to moderate amount. Green tea has a lot of antioxidant health, and there's a lot of different factors there that it actually helps with. Sugar, you also do need to often kind of really detox from it because of those. Thyroid deficiency can also be a root cause of individuals who are having depression or anxiety symptoms. I'll pull up my glasses here because blurs on there. So I always do recommend that is part of the initial screening that you do with individuals. A TSH, now we're going to get into hormones today. We're not going to get into thyroid, but you want a TSH, you want a T3, T4. You also want a reverse T3, and you need to be monitoring those with often, not always, but often they're also their hormones, which we don't go into this, but that can also be a very, very common root cause, especially more often from my perspective and with women, which estrogen dominance, remember we talked about that last time, and that tends to be more dominant in women. So the peripheral nervous system and the GI tract has a very interesting interaction between the two, an actual communication. So there's a direct correlation between high intake of sugar, alcohol, processed. Oops, that's a repeat right there. But this causes that whole body experience. Okay, I've already said that part. But there's neuropod cells that are in the gut, and they are triggered specifically by all of these, but also most specifically, like I said earlier, sugar, fatty acids, amino acids. The signal travels up the vagus nerve, and it can even be triggered when taste is bypassed. That's how we know that this isn't just taste makes us feel really happy and, ooh, I love that taste. That's what we think of. I'm craving it. When we talk of cravings, we think of taste, but really and truthfully, it is a deeper path. It is a deeper physiological reaction. Even whenever they bypassed the gut and gave people sugary foods, sugary carbs, especially the highly palatable, high fat, fried carbohydrates that are sugar, like donuts, those type of things. And they were, liquefied and put in through an NG tube, bypassed the actual taste buds in the mouth and the throat, then into, directly into the lumen in the gut and the stomach. It still triggered them to want more because it still caused that dopamine hit, that dopamine upregulation. It stimulates that dopamine. If you don't already know this, dopamine is that's your motivation. So oftentimes whenever patients have come to me and they say, I just don't care about doing anything. I'm not excited about things. I don't have fun with things. Nothing really excites me. That tells me that they need more dopamine. And because that dopamine is one of the main things that triggers people to feel excited or motivated. So somebody who has a lot of goals, who does a lot of things, they have dopamine. Exercise as a side effect, as a little bit of a side note, actually helps to increase that dopamine. And that's why you tend to see individuals, this is kind of very side note, but that's why a lot of the times people who are highly motivated, they are also very highly athletic. They tend to stay, in their nutrition and their exercise. That's feeding off of itself. Many people feel like they have to have that in order to go, in order to feel motivated. That's feeding itself. So that's one reason why, we look at mental, or we look at so many things by cutting out. We look at exercise in that, oh, I'll exercise because I need to burn off this fat, or I need to worry about my weight, or cardiovascular health. We now, that's pretty well known and accepted now, and people will tend to do that for maybe their cardiovascular health if they have a parent or a loved one or a grandparent who had or has cardiovascular disease. They know they're increased risk. That might be a motivating factor. But we don't often look at that from a perspective in our overall health. Somebody who is suffering from major depression and anxiety, as long as they are cardiovascularly, as long as they're hemodynamically stable and their heart can tolerate exercise, of course, is the caveat there, then and obviously different reasons. They need to be physiological fit for exercise. That needs to be part of their plan, is making sure that we implement exercise in some way, specifically getting the heart rate up, because that is what actually triggers the breath work. That's what triggers everything that stimulates that vagus nerve and the calming symptom in the long run, the dopamine. That's a big part of it. So that should always be a part of a treatment plan, even though people don't look at that as part of treatment. Deficiencies can also be a root cause that you might screen for. So this is something that you would do an organic acids test for, and screening for deficiencies, and or just knowing somebody's history. If you are not necessarily testing vitamin K, I don't have vitamin D on here for some reason. That is essential. That is a very important one as well. Omega-3 fatty acids. We just talked about how that triggers the dopamine, that stimulates that. So being deficient in that's something that is very common in American culture, for us to not have enough omega-3 fatty acids. Fish is, of course, one of our main sources for that. You can also get it in chia seeds. You can get it in tablets and fish oil. Many people don't want to take the fish oil tablets because they don't like the burping it up and that taste, and it is pretty gross if you ever do it. So I don't disagree with them. If that's something that bothers that individual, you can have them freeze them in the freezer, and then they will usually be able to, that it stays frozen into the actual stomach, and then it's absorbed in the gut. So that usually still works, and they don't have that side effect. Chronic stress as a risk factor, we touched on that a little bit already. Stress and depression can reshape the gut bacteria's composition through stress hormones, inflammation, and the autonomic alterations. So, this is where we're talking about it literally directly affects one another. In turn, the gut bacteria releases metabolites, toxins, and neurohormones that can alter eating behavior and mood. So, there's also genetic susceptibility to this, and in almost anything that we talk about, there is. And that's why not always one thing is going to work for every individual. But isn't it just like incredible how we now know so much about this? Obesity also has a direct correlation. There are many, many, many studies on this, but there is a very, very strong association between obesity and extra adipose fat. And we look at the heart health, but we actually have not been looking at the mental health. That is a huge part of it. And that is one of the things that we need to be thinking about whenever we're not concerned for we always have to have many motivators whenever we're trying to eat healthy and enact a healthier lifestyle. Sometimes I don't care. Like I literally don't care if I gain weight or whatever it is. Like it's not about, like, sometimes we just don't care about that. We're like, oh, I'll run it off later, right? We all go back to those negative train of thoughts. But whenever we have a real strong, insightful view of how much it makes a difference in our overall health, that can be a very motivating factor for us. We're reminding ourselves that obesity itself, so the adipose cells, especially around the abdomen, are more inflammatory. That causes the inflammation in itself, is neurotoxic. It can hurt the nervous system. That directly involves our mental health. There are several different proposed theories behind this, but it does increase the inflammation. It leads to nutritional deficiencies, especially vitamin D, just from the actual blockage from conversion of light. Whenever we have more adipose on us, it's not able to penetrate to the level that it needs to in order to have the conversions within our body to increase that vitamin D. So there's nutritional deficiencies besides that, but that's a big one, and or gut dysbiosis. And that is in part because, well, one, more adipose tissue actually increases our estrogen that can cause increased testosterone in women, especially in PCOS. That increases that hormonal imbalance, increases our risk for depression and anxiety. So we can see how, it doesn't stop how interconnected all of this is. And it's not just because we need more serotonin. That's not the only reason why why depression and anxiety occur. History of Lyme disease can also do that. Lyme disease does attack the nervous system. That's a less common cause, but it's something to screen for in the patient's history. A lack of exercise. So I got ahead of myself. We've already discussed enough of that, I think, to thoroughly kind of understand that and increasing in the dopamine. Food allergies, especially gluten. So we've talked a little bit about this before, but it increases our inflammatory processes. You do not have to be, this is something that as a newer practitioner, I did not, or whenever I was a brand new one and I did not have any grasp of functional treatment and food allergies, really, and food intolerances. I do apologize, really, because that should say food allergies, but it should also say food intolerances. There is, I believe, plenty of studies to see that the IgM being triggered is an important factor. So it's not just having like a celiac disease. It's not just having an actual allergy where we have a reaction and anaphylaxis. It can actually be an intolerance to it. The other part of this that a lot of people adopt this theory, and this is what I do believe as well, is that the gluten has just been changed and transformed so much and for so long that it is now something that is viewed in our body as kind of an invader. It's not something that's there for nutritional value. The other part of that, remember we talked about mimicry last time, and it's very similar to some of the other cells in our body. And whenever our body attacks that because of it being mutated and not appearing in our, physiologically appearing to our body as something that is a healthy food, and because it has that cell mimicry and it looks very similar to some of our cells in our body, we have that autoimmune trigger that by itself can also trigger and induce anxiety and depression. Mold exposure. This one is controversial. There are many people that say that this doesn't make a difference at all. I will tell you without a shadow of a doubt, I have treated individuals who they ended up removing themselves from the mold environment. There was, I won't say anything more than that just to make sure that we are not breaching anything there. But without a shadow of a doubt, I have seen this completely transform individuals, removing that mold. So this is where if we can't remove ourselves from the environment, we can't move homes, we can't move office buildings, or wherever we know that exposure is, we can use things such as the HIPAA filters. Those can be really effective. You can get them on Amazon now for $50 to $100, which I know can be investment for many people, but whenever you think about the effect of your health, it's a huge, huge investment that will pay multiple dividends to you. But the mold exposure can also be neurotoxic to us. Overwhelm itself. So sometimes people in our culture, we think, okay, so I need a medication so I can keep going, and that's not necessarily that's not a healthy way of doing it. Sometimes it literally is that we just have too many things going on. On the overwhelm, I really want to talk more about gut microbiome than what we have already. So I'm just going to touch briefly on this, but I think it's really important, and it's not functional, super interesting, but it is still a functional root cause in the overwhelm world, especially with notifications. So I have certain things on my phone, and certain times when I have to have my phone off of silent, and certain times I do have to have notifications on. Most of the time, though, I do not have any notifications on my phone. I do not get any dings when I get an email. I do not get a ding whenever I get messages. And there are times when maybe that, falters and I miss messages from people when I would love to message them back just as fast as they messaged me. But the truth is that that is a huge cause of overwhelm in our nation. We have overstimulated ourselves to a massive, massive degree. And I would love to hear from any of you and watching the replay, or, by the way, if you are watching the replay, type down their replay for me, or R for short if you can't type out the whole word. But I would love to hear, your take on this. Have you experienced this yourself? There is an alarm fatigue going on for nurses, for providers, for practitioners, and it is really overwhelming. There is actually many studies that have been done. And did you know that the leading profession, at least the last time I checked this, which honestly was a couple of years ago, but whenever I checked it before, the leading, if it was not, then it was the top 2 or 3, but I believe it was the leading profession for suicide rates was family practitioners. And the reason being, what they boiled that down to is the computer use and the overstimulation from constant notifications, constant pop-ups, having to deal with the computer, not being able to work, all of those things. So that is a real thing that we shouldn't be medicating, we should be removing. And we don't do that in our culture. We keep fighting for the next thing. We keep on fighting to keep up with the Joneses per se. And then, medications wear off. They don't work as well. We have to up them. That's why, finding a root cause sometimes literally is just overwhelm. There's just too much stimulation. Okay, moving on. And then also, of course, alcohol, long-term use causes suppression of our serotonin that's naturally made in the body. So because of that, people can get really depressed from alcohol. That's not anything that's probably new to anyone here. Ooh, I clicked it twice, so maybe too much. Inadequate fruit intake and gut rebalancing can also be a cause. So whenever we replace that, we actually see an improvement in anxiety and depression. Again, it's not just not eating the unhealthy stuff. People, look at their health and they say that, oh, I'm going to avoid the bad stuff. I'm going to eat healthy. And they're looking at calories, they're looking at carbs. While that is important, and we know that that does play a part in your mental health, the issue is really the lack of the really good stuff. So those foods have the natural prebiotics and probiotics that are actually a part of our mental health. And that's something that I was really wanting to talk a little bit more on. If you can't hear my baby, I think he's going down for a nap. Nana has him right now. But we actually have, so microbiome is a big part of our mental health. And the reason why is that we actually have microbiota in our gut. You have like 6 pounds of it. The average individual, the average weight, it is you have more of them than you do cells in your body. And they actually make up they actually will make things such as GABA, GABA. Uh, they make up serotonin. They make our dopamine. They make a big part of the things that are affecting our mental health. So if we have, if we have an imbalance in that, we don't have the healthy microbiome that we should, we're not going to make enough of that. Sleep deprivation, we're going to talk about on the next slide. So I'll kind of hold off on that, but that is a root cause, both because of the obvious. Whenever we don't sleep, it can make us very anxious and depressed. And I mention that because it's really, to me, it's a very obvious thing. Whenever I haven't slept, I'm very anxious. But to many people, they don't associate that, or they've been doing that life for so long, they don't realize that that isn't a normal thing to feel. Exposure, excessive exposure to artificial light, including blue lights, and the lack of the healthy lights make a big difference in our mind. Blue lights are also something, if we do a discussion over ADHD, that can make a big difference. That's why, like my glasses here, they do have blue light blocking. Whenever my son uses, I have to admit, I got him an iPad, didn't want to do it, but whenever he uses that, he is timed on it. He cannot use it, but in rare occasions and for a limited amount of time. But he also has glasses that block those blue lights because they increase overstimulation in our brain. Lack of exercise, talked about that. Leaky gut. So bacterial lipopolysaccharides, or LPS, are the major outer surface of the membrane components that are present in almost all gram-negative bacteria, and they act as extremely strong stimulators of innate or a natural immunity, but also become toxic during leaky gut. So LPSs are kind of a double-edged sword. They're a really good thing whenever we get too much, or we have it during the presence of our during a leaky gut syndrome. They become neurotoxic, and they can actually cause to worsen the instability and also exacerbate symptoms of anxiety and depression. So they enter the bloodstream, and it's not a good place. That's not where they're supposed to be. So injection of LPS into test subjects is well documented to increase insomnia, fatigue, decreased REM sleep. This is obviously going to go down another channel where we're increasing anxiety, we're increasing the depression through that. And the depressive symptoms happen as well, both because of what we're causing in their sleep, but also just because of the LPS itself increasing it. And then it also additionally, even the enjoyment of high quality foods is diminished. So really just life doesn't get near as fun whenever that happens. So leaky gut itself is a big part in that. And I can attest to this personally. Whenever I would get into IBS flares, I'd get worse, I would feel really, really irritable, not happy, depressed, literally depressed. And it was all from food. We're also going to talk about one thing before, we're getting close to our time limit on this, but I also want to talk about one of the things I'm most passionate about, and that's eliminating MSG, monosodium glutamate. And we're going to look also about how we have studies now that show it's not good for our mental health. Sleep deprivation. So we're going to talk on this kind of briefly because I really want to get to MSG. Linkages exist between the gut microbiome composition and sleep physiology, the immune system, and cognition. There's an association between improved sleep through the manipulation of the gut microbiome. So they have done studies where they have literally they've done this for obesity, they've done this for anxiety, for depression, they've done it a lot of different ways. Yeah, not everybody wants to do this. This isn't necessarily being proposed as a treatment plan that I'm aware of. It might be in some areas, but I have not seen it, where they actually take a fecal transplantation, meaning exactly what it sounds like. They take the feces, the fecal matter, the fecal matter of an individual who has, healthy weight, the individual who does not have anxiety, the individuals who are sleeping well, and they transplanted it into the individuals who are the opposite, who are sleep deprived, who have insomnia, who are obese, who are not healthy in that certain area. And they see a significant improvement. There are some studies that are a little bit conflicting on that. Part of that might be that Like I alluded to before, we have so many chemicals in our world. We have so many different reasons why people may not have a healthy gut microbiome. Maybe they were C-section, maybe the hospital that they were in, they were exposed to different birth is what I mean. They were exposed to different things because our gut microbiome starts changing immediately after birth. If you weren't exposed to the vaginal canal through a C-section, if the first individuals who touched you more than anything else were people who were you know maybe they were they were sterile, they didn't they didn't have any of the healthy microbiome because of hand washing, those kind of things, which I'm not saying they shouldn't. I'm not saying that at all, but because of because they have to keep a more sterile environment, uh, tons of different things that change, whether they had a pet growing up, whether they didn't have a pet, all of that stuff changes our gut microbiome. So there's a lot of variation out there yet, and we don't have it completely nailed down. There are certain strands that we're not going to be able to get to today, but there are certain strands that have been really associated to this. There's even some strand. There's even one strand, L-reuteri, that is associated with they're tying that to autism. And I don't like talking about that topic because there's so much controversy around it, but maybe we'll actually go into that a little bit depth where we can actually show more studies and that type of stuff, because I like to have studies and stuff so we can see that this is not just woo woo pulled out of TikTok experts speech or something like that. But it can affect all of that in such a big way. The human gut microbiome can exert effects on the mental and physical health through the different routes, including the brain gut microbiome axis. So we know that the brain talks to the gut as much as the gut talks to the brain. So for a long time, it's been accepted that IBS flares can happen as a result of anxiety, that anxiety can trigger that IBS flare. And that's true. That's not untrue. That is true. But we also now know that the gut itself, from many of the things we talked about today, can also influence I'm pointing just to the brain, but I shouldn't be, right? Like I should be pointing to our entire body because that's really what is affected whenever it comes to anxiety and depression. But we know that it goes both ways. Intestinal activity and the competition, exclusion of the pathogenic bacteria. So meaning that if we have a bad overgrowth, if we have too much of the bad, it's going to knock down the good. The good is not going to be able to thrive as much. So that might happen in somebody who has SIBO, short intestinal bacterial overgrowth, somebody who is like really constipated. They keep on having relapsing issues. Especially you would actually test to see if they have SIBO. But that's an individual who would definitely be within that category. A lot of people, that's why hindsight now, especially some patients are like, oh man, I wish I still saw that person before I was in functional world. And it's like, oh, they were both constipated and insomniacs, which is very, very common. And that is also another reason why. So that brain gut microbiome axis signaling in particular has been shown to be bidirectional, which I actually just already said. So we know that bacteria influence the health behavior. They actually influence whether or not we're making enough serotonin, whether or not we're making enough dopamine. And there's resources down there for you on that. I think our next one is going to be our last slide. Yay. Okay. I want to make sure we got to this. But MSG, so there's now emerging evidence suggests that MSG may directly influence the glutamatergic neurotransmission, which underlies the pathophysiology of mental illness, even as far as schizophrenia, but also in depressive disorders. So this is something that really does hit very, very near and dear to my heart, because this was before I didn't know that, and I hate to, dog anybody, but Chinese restaurants tend to be very, very high. They're one of the highest uses of MSG. And I'll never forget, and thank goodness, the last time we went to a Chinese restaurant, because I used to think, well, you can get so many veggies there. And, I was looking at health from just that factor before I knew about all of this. And I used to love going there because I was trying to eat healthier. So I could eat things that were, white rice, not fried. And I could eat vegetables and those type of things because they do have like those kind of things that you can't get anywhere else. You can't get broccoli at McDonald's, but you can get it there. But that MSG trumps that healthiness, especially for someone who is very sensitive to MSG. But we know that chemically, the glutamine acid is amino acid necessary for the biosynthesis of glutamine, a key neurotransmitters. So we know that it actually affects our mental health, that MSG does. And especially somebody who maybe they have a child who's having a lot of outbreaks, a lot of outbursts, those type of things, anxiety, depression, screen their diet for that. The other part of it is you can avoid places that use it. However, also sometimes some seasonings have it. Some of the seasonings I used to love to cook with, I can't remember the name of them, or I'd say them right now. It's been a long time. I remember one of them was yellow with like a red outline on it, but it has MSG in it. So some of the things that we bring into our home without realizing we're cooking from home and we're adding MSG to our foods. And MSG is just, it does so many different really bad things to us, but it definitely affects the mental health. And so these are all just different root causes to be looking at. By far, this was not even an exhaustive discussion. I think that we covered a lot of things, but we really covered a lot of things, not all of the things. And we covered all the things just very, very lightly. And we didn't really go into very much depth, but like I said, our point in this was really, I hoped to broaden your idea of what mental health is and how it really encompasses many, several different aspects, and how we really have to look at not just the whole person, but also look at the whole person's experience, what they've been through, what they've done, what they have in their life, but then also just simply what is in their diet, what is not in their diet, and the different ways that we can test and look at things. So this is why and how things such as a full comprehensive GI map can elude us to a lot of different things in their mental health. Why an organic acids test is really important for finding a root cause of their anxiety and depression. It might be as simple as a few deficiencies. It might be as complex as all of these things affecting everything. And that's why, whenever somebody would come to me and they'd say, I just know it's my hormones, I just know it's this, I just know it's that, I'd say, you're probably partially right. You are probably partially right, but I'm betting that there is so much more there. And again, if you are somebody who is, I don't want to forget. So let me do this. Let me stop myself here. If you are somebody else, you are somebody who is needing help, or you're wanting to really look at your health in an in-depth way. I'm a functional practitioner, but I also have several functional practitioners who can help you. So if I don't have availability, I can get you to somebody who does, who is an actual provider, who is a true either registered nurse if you're needing a nurse coach, or somebody who is a functional practitioner, a nurse practitioner who is medically licensed. There are a lot of functional people who are not medically licensed, and that's something that maybe we need to monitor for, but because there is also so many different things for us to look at, and so many different aspects that we need to be making sure that we are monitoring for and understanding in a very, very deep level. So that's what I'm looking for. Oh, I'm getting closer. Okay, here we go. So the links are here. You must do it within 24 hours of the registration to get it for free. So you can watch this replay. If you have any questions, reach out to me. I always try to get to all of my emails and messages within 72 hours. At the time of this recording, I'm still the one responding to all my messages, still the one responding to all of my emails. Sometimes it comes in a long time, so give me 72 hours, but usually I try to respond within 24 to 48 hours. Weekdays, I will still sometimes respond on the weekends, but give me the grace of the weekend, and that I might not. It's gonna be weekdays for sure. But this is your link here coming back through, and if you don't catch it within the 24 hours, you can still get the CME. It's just $10, and then we'll get you the link for that as well. It should be below in the links if you want to get the CME for this. If you watch the whole thing, why not? Make sure that you get those CMEs. These add up really quickly. We are about to launch a functional medicine for nurses and practitioners application, phone app. And we are going to have these within, so you will be able to get full access to these even past the 24-hour mark is what I believe. Hopefully we're going to be able to work it out with the app. I'm developing it myself. So be looking for that because we have that rolling out pretty soon. And then, of course, also IFN is now taking applications. So this is also case sensitive, but you can go to bit.ly. So that's an easy way to make short links, but bit.ly/capital IFN for Institute for Functional Nurses application. If you are somebody who is wanting to be a part of our functional nurses mastermind, so this is something that's going to be going on for the next year, and you can have all of the support that you need in becoming a new functional practitioner. You have individuals you can read case studies to every single week. We work together, we support each other, we refer to each other. It is also a referral network, just like I'm doing now. If you are somebody who's catching this replay and you think, I think these may be some of my issues, but I need to actually get the testing done, I need to get the information that I need to find my answers, then I can set you up with the best individuals, literally the best individuals for you, and get you to the right individuals. So if you're somebody who's wanting that support and you are wanting to become a functional practitioner yourself, then we are accepting applications for the mastermind. We are going forward also planning on having a live event, and it's going to be very fun, very luxurious. You're going to get the full year support. This isn't just something that you just get run through and you watch the courses and then it just shuts you down. So it is a full group of individuals to support you, as well as myself, and we have weekly meetings with that. So in addition to all of the modules and learning, how to practice and how to implement functional medicine, maybe you want to implement that into your current practice, and that is very awesome. That's exactly how I started. Maybe you're somebody who you're ready for the next level and you want to start and launch your own practice. It's also a very awesome thing, and it's where you can really start finding a lot more freedom. And maybe you're somebody who you're a little bit you're not too intimidated by the tech side of things, and you want to do courses and you want to have that evergreen passive income. We also have a program depending on how much information you need. All of these are CME certified, and you can actually learn how to do that yourself and learn how to set up programs and educational sources that you can share to the masses and be able to be, one of the people getting all the Google hits and people purchasing from you just online passively. That's something that is very rewarding. And, I teach my people how to do all of the things. So I don't ever hide back. I don't hold back anything. But if you're somebody who any or all of that sounds like a right fit for you, we have the program that will fit your needs in that regard. So you can go to the bit.ly/IFN application, and we will get you set up and get you plugged in. As long as you, obviously, I really shouldn't have said exactly like that, but with the application, then we'll have you'll have an actual interview and those type of things, but we'll get you set up on the right track to getting those dreams set up. And I'll never leave anyone hanging. I'll always give you the support you need to, if this isn't a right fit for you, I'll always direct you in the right way that is best for you. So thank you for jumping on, everybody. And please, let me know your thoughts, your comments. If you watch the replay, write down replay. If you're live, type in the chat live. I love seeing you all and your feedback. It feeds me, it fuels me, and allows me to keep on doing this. And I really love doing this for free, mainly because I want this information to be in the hands of the best people who it should be for. So thank you again, all, and many blessings.